Hi guys, my name is Ashley. I'm a physical therapist here at Physical Therapy and Balance Center in Rockville, Maryland. And today we are going to be talking about the vestibular system. So we're going to tell you a little bit about what it is and what it does. We're going to talk a little bit about the anatomy and tell you how it works. And then we're going to talk about a few things that can happen when the vestibular system malfunctions and something goes wrong. So before we really get into what exactly it is, it's important to understand that there are two parts to the vestibular system. So we have what's called the peripheral vestibular system, and that's the part that's a little bit easier to kind of conceptualize and visualize because that's the part that's located in our inner ear. And then we also have what's called the central vestibular system, and that basically consists of all of the connections, all of the pathways in the central nervous system that connect the peripheral vestibular system with the brain and the brainstem. So those are the two parts. Now let's talk a little bit about what exactly the vestibular system is. So the vestibular system basically is our body's way of detecting and interpreting head movement. So if I turn my head to the left, my vestibular system tells me, 1, that my head is in motion, 2, which direction I moved it, and 3, how quickly I moved it. So that's kind of a really important way for our body to tell, where our head is in space and therefore where our body is in space. So that's, pretty much what the vestibular system is. Let's talk a little bit about anatomy. So I'm going to we have a model of the inner ear. So the vestibular system, the peripheral vestibular system, is located inside of our inner ear. And the cool thing about this model, this was actually made by one of our former PTs, is that it's a scale model of the inner ear. So obviously it's much, much bigger than our actual inner ear, but it is to scale, it is anatomically accurate. So if we look at the inner ear here, there are two parts. So this part that kind of looks like a snail shell, this is called the cochlea, and that's what helps us with hearing. And then this part on the other side, this is our vestibular organ or our balance organ. And there are a few structures that I want to point out on the balance organ. So right here and right here, we have two structures that are called otolithic organs. One is called the utricle and the other one is called the saccule. And basically what these structures do, they help us detect linear head motion. So these structures contain little calcium carbonate particles, or as a lot of you know them, crystals. They contain little hair cells and they contain fluid. And all of those things kind of work together to help us detect that linear head motion. So the utricle detects head motion in a horizontal plane, so side to side head motion. The saccule detects motion in a vertical plane, so up and down head motion. So then over here we have 3 semicircular canals. So I'll turn it so you can see a little bit better. This one is the anterior canal, sometimes called the superior canal. This one is the horizontal canal or the lateral canal, and then this back one is the posterior canal. And this is the one that's often involved when we talk about that benign paroxysmal positional vertigo. But these canals also contain fluid and they also contain hair cells. Basically how they work, when we move our head in the plane of one of those canals, the fluid moves within the canals and it deflects the little hair cells that are inside the canal. Those hair cells are basically sensory receptors that then send a signal to our brain that tells us that our head moved in that particular direction. So this is a right inner ear. If I pitch my head back and to the right, I'm stimulating my right posterior canal. So these canals, we talked about the otolithic organs that detected that linear head motion. These semicircular canals detect angular head motion. So again, I move my head back and to the right in the plane of that posterior canal. That posterior canal is what's stimulated. So that's a little bit of the anatomy. The other thing that we're going to talk just a little bit about, the vestibular system is involved in a few really important reflexes that happen in the body. And one of them is called the vestibulo-ocular reflex. And this is basically a reflex that allows us to maintain our gaze on a target while our head is in motion. So if I am walking down the street, as I'm walking, I have maybe a little bit of vertical displacement. My head's kind of moving up and down a little bit. My eyes are moving up and down a little bit. This is the reflex that still allows me, even with that little bit of vertical displacement, to read a sign on the side of the road. The letters, I'm able to stabilize my gaze right on those letters, and I can read that sign without those letters looking like they're moving up and down. That is because of this reflex. So this is a really important reflex. We use it pretty much all day long. And just to kind of give you a visual, we're actually going to show you one way that we test for it. So I'm going to bring over Amanda. She's going to be my subject today. I'm just going to put on a mask and a pair of gloves. So you can grab that. So we're going to kind of zoom in on Amanda's eyes here. Maybe hold it. Yep, that's actually pretty good. All right. All right, so what I'm going to do is move Amanda's head pretty quickly in different directions, and she's going to try to keep her eyes right on my nose. So in someone that has an intact vestibulo-ocular reflex, they should be able to keep their eyes right on my nose even if I move their head. So stay right on my nose. Good. So regardless of which way that I move her head, she can keep her eyes right on my nose. That's because of this reflex. So now let's kind of show you what happens if this reflex kind of, malfunctions or is absent. So Amanda has an intact vestibular ocular reflex, but we kind of coached her on what to do here. So she's going to kind of simulate what happens when this reflex is not intact. Good. So we'll show you that one more time here. Okay. So her eyes, that's good, thank you. So her eyes really went with her head and then made a quick correction back. Whoops, I'm not sure what I did there. Sorry about that. Made a quick correction back to my nose. So when does that happen? When would someone have, or an absent reflex there? There are a few conditions that can cause you to lose function in your inner ear on one side. Things that can cause that: an infection, a viral infection that goes to the nerve that goes to that vestibular organ, a small stroke in the circulation that supplies that vestibular organ. But basically, when you lose function on one side like that, that reflex on that side is absent. But the good news is that the brain can do a really, really good job of kind of compensating for that. And eventually, if someone were to have that kind of loss of the reflex, say a year down the road, if I turn their head quickly, their brain has kind of pre-programmed that eye movement. So it almost would look like, nothing was even wrong. So that's the vestibulo-ocular reflex. So now let's just talk a little bit about, some pathology with the inner ear. So there are about 1 million conditions of the vestibular system. We're not going to talk about all of them. Certainly there's, the infection to the nerve, there's that stroke that we talked about, and then you have more complex disorders like Meniere's disease, superior canal dehiscence. We're not really going to talk about those things, but kind of the overarching really moral of the story with the vestibular system, it really is a case of use it or lose it. And basically what that means is that our vestibular system, in order to continue to function optimally, requires consistent stimulation. So I like to use the example of someone that's in the hospital. So say you have someone that had a medical emergency and they have just spent the last 10 days in the intensive care unit in the hospital. And while they're there, they are sedentary. Hopefully physical therapy is going in there and kind of getting them out of bed and getting them moving once or twice a day. But for the most part, they are spending almost, all of their time there lying in bed. So as they're lying in bed and they're sedentary, their vestibular system is not receiving any kind of stimulation. So say 10 days goes by and they're medically stable, they're discharged from the hospital, and they go home. When they go home, they're kind of, maybe walking around the house a little bit, and they're definitely doing a little bit more. All of a sudden, the vestibular system is stimulated over and over again, and because they were so sedentary for 10 days, now the brain is receiving all of this input that it wasn't receiving before, and the brain doesn't know what to do with that. So that's when people can feel dizzy. So kind of moral of the story, staying active is the best thing that you can do to kind of keep that vestibular system sharp and working well. The other thing that tends to happen, especially as we get older, we do get some degeneration of the vestibular system. We get degeneration of those little crystals that we talked about, of the hair cells, and that in combination with maybe becoming a little bit more sedentary as we get older can definitely be kind of, a recipe for some malfunction in the vestibular system. So some of you that maybe have had balance therapy before in the past here, maybe you've wondered, like, why the heck do you guys keep making me turn my head? Because we do a lot of that here. There's a lot of head movement involved with our exercises. And part of that is because it's definitely a functional activity. You need to be able to walk safely while you turn your head from side to side. You need to do that in the grocery store, when you're out for walks. It's just a really functional thing. But the other reason that we do it is because when you turn your head, you're stimulating your vestibular system. And that's some really important input that we want you to get while you're here, and we want to be able to keep that vestibular system sharp. So again, moral of the story, we definitely want to be staying active. Head movement is what stimulates the vestibular system. So keep moving, stay active, and that's all for today. All right, bye guys.